Right, good evening everybody. I hope everyone can hear me okay. My name's Rob Miller. I'm the director of the Cuba Solidarity Campaign, and I'll be hosting this meeting about what we can learn from Cuba and Cuba leading the fight for global health equity. As well as our wonderful guest speakers tonight, we also have Ryan from the Cuba Solidarity Campaign who's hosting the meeting. If there are any technical issues, Ryan might appear, but hopefully everything will go smoothly. And we hope to finish this meeting by 8 o'clock tonight at the latest. I'd like to thank all of you for joining with us. We've got people joining as we speak, and we'll let you know how many are joining us later, but they're also on YouTube as well as on Zoom. So welcome to everybody who's joining us tonight. I'm delighted to say that we've got speakers with us this evening from Canada, from the United States and the United Kingdom to compare Cuba's response to the coronavirus pandemic in the context of its commitment to public health care in Cuba, its preventative medicines and its medical internationalism. And we're also honoured tonight to have with us the Cuban ambassador, Her Excellency Barbara Elena Montalvo, who will say a few words later on in the meeting. So welcome, Ambassador. So first of all, I'd like to welcome our first speaker, Gail Reed from the United States. Gail is the founder of the Medical Educational Cooperation with Cuba and the executive editor of MEDDIC Review. Gail also produced the award-winning documentary film, which I'm sure many of you have seen, Salud, which looks at Cuba's quest for global health. Gail has a wealth of experience of Cuba's health service, and she is involved in facilitating the exchanges between the United States and Cuban medics over many years. And she's going to speak about the comparisons between Cuba's system, health equity in Cuba and the United States, and the differences or similarities possibly between both nations' responses to the pandemic, as well as giving her own personal overview of MEDDIC's exchanges and lessons from Cuba over the years. So we're really pleased to welcome Gail Reed. Over to you, Gail.
Unmute. Did I do it? Okay. I'm hoping that everybody can hear me all right. Does it come through okay, Rob? All right? Yeah? Okay. Well, I want to say, first of all, thank you so much for having me. I very much appreciate this opportunity. And if you all would like to learn more about Cuba's response to COVID-19, please do check out our April issue of MEDDIC Review, which is MEDDIC Review, MEDDIC with 2 C's altogether, medicreview.org. And you can get a sense of the breadth of the Cuban response there. I am right now actually in Chile, where my son and daughter-in-law had their first baby, so I'm a new grandma. But I'm also stuck here. Let me tell you, in Chile, there are 242,355 cases of COVID-19. This is 100 times the number of cases in Cuba. So it's not only the US that is having a tough time, and we're seeing that the Americas is really turning into the epicenter of the COVID-19 pandemic at this point, with Brazil second only to the United States in the number of cases and deaths. So what I want to do is talk a little bit. I took some notes to try to get through this in a way that would be at least not too boring for folks. But I want to start with explaining the differences that I see in terms of the Cuban and the US health systems. There are 7 main differences that I could point to. The first, and I think the most important, is the principle of the thing. In Cuba, and for Cubans and for people who Cubans care for the world over, health and health care are a right. And that is probably the most definitive difference, because in my country, in the United States, healthcare is a commodity, pure and simple. And that's why we're seeing such grave differences today between those who can purchase that commodity and those who cannot, between those who have health insurance and those who are either uninsured or underinsured. So that's the first difference. And this leads to the second difference, which is that in Cuba, the system is public, universal, and free. And that means that there's an enormous amount of resources within the scarce resources of Cuba, a great proportion devoted to health and welfare, which is about 26% of the national budget. In the US, there is an enormous outlay of out-of-pocket expenses. Health care expenses are still the #1 cause of family bankruptcy. So not only do you have to worry about yourself or a loved one getting sick, you have to worry then about what happens afterwards. You have to worry about the bill. We have the cases of people with COVID-19 who have been socked with a $1 million bill after recovering. So they're wondering whether they should have recovered, I think. We're also seeing that when you get to questions related to income, questions related to race and ethnicity, we're seeing terrible differences, not only in COVID-19, but in all kinds of health parameters. So this is not in the US just a disease that is more rampant among older Americans or those with comorbidities, other factors, but also race plays an enormous role. In Cuba, there is a single system, a single public health system. In the US, it's a very fragmented system, but not only between public and private, between private and nonprofit, all kinds of different providers enter into the health system, which means that a coordinated response to something like COVID-19 becomes more difficult. In Cuba, there is a strong, vast, and universal primary healthcare subsystem, which places over 10,000 family doctors and over 10,000 family nurses literally around the corner or up the hill from people everywhere in Cuba. In the United States, primary care docs are not that easy to come by, and it's not clear that you should go to them first before heading to the emergency room, which then compounds the issue because people go to emergency rooms when they are more sick. There is little preventive care in the US, which is a hallmark of the Cuban system. Then we have the fifth element, which is Cuban pharma and biotech, which is linked very closely to public health. Those products and diagnostic kits and vaccines that are produced by Cuban biotech are intended first to be applied in the public health sector in Cuba itself, and then they become earners for the public health system. In the States, what you have is biotech and pharma linked to itself, to big pharma. So you have some outrageous pricing of medicines, which you do not have in Cuba. And you have also big pharma responding to its own profit model. It's not responding to a public health concern. In Cuba, health professionals are trained in the idea that their patients have a right to their services. And I think this is a fundamental ethical difference from the United States. And they're trained also to work in teams. In the States, we see a very hierarchical system in which the doctor is a sort of, in some cases, a god that is looked up to, highly competitive medical school training in which there's very serious burnout, and people who are just not trained to see their patients in any kind of light other than as clients, which is a real shame for health professionals who enter the profession often dedicated to a whole different ideal. And finally, there's the notion of global health cooperation. In Cuba, it didn't begin yesterday. It began in 1960, actually, to assist in this country, in Chile, with an earthquake, the world's most serious earthquake in recorded history in Valdivia, Chile. And since then, over 420,000 Cuban health professionals have served abroad for the last 50 some years. And so it really is embedded into the values of the system. In the United States, global health cooperation is not even on the map. And in fact, with this administration, with Trump, he's trying to stop the collaboration of Cubans abroad. And so I think this is a real moral degeneracy on the part of this administration in particular, as opposed to the Obama administration, which recognized the importance of the Cuban health professionals abroad. So what does this all mean for the COVID-19 response? What's the differences that you see? In Cuba, you see a coordinated single national effort, which starts with the health system, but is much broader than the health system, that is headed up by the president himself, that involves civil defense, that involves transportation, tourism, all the labor sector, all kinds of sectors in Cuba working towards a single goal. This is very tough to get happening in the US, where the approach is very fragmented. And also we're seeing opposing criteria. States are asked to figure it out for themselves. And then there's the private sector versus the public sector. It's a big mess. And this is how we get the numbers that we have of people who are infected and people who are dying. In Cuba, therefore, there's a single message. There's a single message that goes out every day in a press briefer, an presser that is held every day by Francisco Duran, a doctor who is heading the epidemiology in Cuba, to let the entire population know what is going on with COVID-19 in Cuba and what is the data, what are the dangers, what are the different strategies being applied. In the US, you have competing and contradictory messages all over the place, starting with Trump himself, who in the very beginning, as we know, didn't even recognize that the COVID-19 epidemic was worse than a common cold, all the way through to his rally in Tulsa, where he dangerously exposed several thousand of his followers, not as many as he would have liked, to the germs, to the virus of COVID-19. And then you have people like Anthony Fauci, who is a respected epidemiologist, having to watch his words as he comes out and tries to make sense of all this. So what you see then in Cuba is the health of the population is put first. In the United States, it's all about politics. It's all about electoral politics at this point, including whether people can go out to vote or can't even vote by mail, which is now something that there's a major debate about. In Cuba, they're getting to the point on June 18th, the other day, where they started to open up, which is going to be gradual, asymmetric geographically, depending on the epidemiological picture, and really based in a very logical way on a 122-page strategy memo. In the US, it's been very haphazard. We're already seeing a resumption of outbreaks, peaks again, doubling of cases in certain states. It's all very, again, fragmented, haphazard, depending on the different politics of the different pressure groups. In Cuba, all of this has been guided by science. There's a respect for science. In the US, science is often on the margins, as we've seen with the CDC, which should have been front and center to the response, has been sidelined in a lot of cases. And this is very dangerous. It's also very dangerous that the US has withdrawn support from the World Health Organization at a point where cooperation is more needed than ever. So this is what we're seeing as a difference there. The Cubans, as I mentioned, have a clear strategy. The strategy started out with physical distancing, with information to the population, with closing the borders, and then went on at a point where they did not have a great number of the PCR tests, which are the definitive tests for COVID-19. But what they did have were primary health professionals. And that included about 28,000 medical and nursing students. What did they do? They decided to do active case detection, going door to door to actively screen for fever and other symptoms for 9 million out of 11 million Cubans, prioritizing the most vulnerable, those in nursing homes and other institutional settings. Off of that, and as they began to test, they isolated in isolation centers and hospitals the people who had symptoms. Then they tested those people. Then they contact traced all of the contacts of those people, isolated the contacts, continued to test with the rapid testing. And all of this has resulted in a very complete and very clear strategic momentum that then leaves them with literally every person who has COVID-19 in Cuba is in hospital. Now they have a greater number of PCR tests, and so they've been able to test over 150,000. And this is something then that goes back to primary care at the very end of this process. A person who is recovered is only considered recovered if they have tested PCR negative, and they must then self-isolate at home for 14 days, followed again by their primary care physician. So it's a very clear strategy. They have only locked down, they've only quarantined specific areas, not all areas. So this is an important thing. Finally, they have incorporated biotech and biotech products into the strategy in a very successful way. So I'm just going to give you, as the time is running short, the results. Today, Cuba has 2,315 total cases. That is 20 cases per 100,000 population, compared to 700 cases per 100,000 population in the United States. They have 85 deaths, under 1 per 100,000 population, as compared to 37 per 100,000 population in the States. And right now, there are only 115 active cases of COVID-19 in Cuba, 114 stable, and 1 critical. You also do not see the disparities. In the eastern provinces, there are fewer cases than in the western provinces, the eastern provinces notably being darker skinned. And in the US, you're seeing 22% of the deaths from COVID among the African American population, which represents only 13% of the total. We're seeing important results from Cuban biotech, which we can go into later. And also, and I think others will go into this, John Kirk in particular, over 3,000 Cubans have been serving in 27 or 28 countries since the COVID-19 pandemic began, joining those in 59 other countries. So, and the majority, by the way, are women, which I have to say that is something that I am very proud of. The majority of physicians in Cuba are women, and also of these global health internationalists. Thank you.
Thank you so much, Gail, for those brilliant words. It's always lovely to hear someone from the United States speaking so eloquently. We hear a lot from the US, which it's very nice to hear firsthand from someone like yourself. I mean, there are similarities, obviously, between the Trump administration and some of the actions of our own government, but it's great to hear from you. Our next speaker is John Kirk, and John is a professor at the Department of Spanish and Latin American Studies at Dalhousie University in Canada. And he's written and edited numerous books on Cuba, international relations, culture and medicine, and including a book which I highly recommend, Healthcare Without Borders, Understanding Cuban Medical Internationalism. I know John spent some time himself with an international Cuban medical brigade, and he's going to talk now about not only the history of Cuba's wonderful internationalism, but their present day internationalism at this time of international health crisis. We are quite restricted on time because we've got a lot of speakers, so hopefully we can get through everybody in the time allotted. So if you can bear with us on that, I'd be very, very grateful. John Kirk, over to you.
Thank you very much, Rob. Can you hear me okay? Yeah, okay. Buenas tardes a todos y a todas. Es un gran placer estar aquí con ustedes. I really appreciate the opportunity to share with you my observations. I've been studying medical internationalism for the past 15 years. It's an extraordinary story. It is something that I chanced upon, and since then, every day I look at it, I remain as surprised as ever. The current situation in terms of medical internationalism is very well known. Cuba has received dozens and dozens of requests for medical assistance, and as we know, 34 Henry Reeve brigades have gone to 28 countries, the most recent, the Turks and Caicos. So we're talking about 3,300 doctors, nurses, technicians who are now working in 28 countries. It's extraordinary. To put that in context, it would be the same as if the UK were to send 19,000 doctors, nurses, and technicians to the global south, or in the case of the US, 105,000 to the global south. So you can see just how extraordinary this contribution to humanity is by the Cubans. And as Gail pointed out, already before COVID, before anyone had heard of this, there were already 28,500 Cuban medical personnel working in 59 countries. Again, before COVID, there was this extraordinary army of white medical coats, as they're referred to. So there's an extraordinary contribution at present that Cuba is providing. What I want to do today in the time allotted, and Rob, feel free to sort of to signal if when time is running out. I think I'll be within the limits, but I won't be offended if you give me a shout. I want to talk first of all about the early days. In 1959, there were 6,000 physicians in Cuba. By the end of 1961, there were 3,000. In other words, half the Cuban physicians left for mainly for Florida. As Gail pointed out, in 1960, the very first Cuban medical mission departed for Valdivia in Chile, where there was a massive earthquake. In 1963, a large delegation went to newly independent Algeria to help set up the Algerian healthcare system. Now, again, try and bear in mind the context. Cuba was losing half the number of doctors it had, yet still sent out medical delegations, brigades to Chile in 1960 and 1963. So those early days set the tone for what is to come. And I think it's very important to bear in mind that what we're seeing now is the continuation of something that was set up in 1960. So the Henry Reeve Brigade's work fighting Ebola in 2014 in 3 West African countries, the Henry Reeve Brigade now in 28 countries, is the logical continuation of something that was set in motion by Fidel Castro back in 1960. So this is the continuation of a trend that is continued. So that the early days set the tone, and it is crucially important to bear that in mind. Since then, what is extraordinary is that medical cooperation has continued in dozens of sub-Saharan Africa in the integrated health program. There are thousands of Cuban medical personnel who've been working, an extraordinary contribution that's been made. I'd like to indicate some of the lesser known but enormously important examples of Cuban medical internationalism. By the way, the Cubans don't refer to this as medical aid. Aid is seen as a paternalistic concept. Instead, this is colaboración or cooperación, but it is not aid. And I think that that speaks volumes of the way that the Cuban government approaches this. Chernobyl, the nuclear implosion, the nuclear meltdown that took place in the Ukraine. Between 1989 and 2011, Cuba received for medical treatment 25,000 children. And it is extraordinary to again look at the historical context. This is at a time when the Soviet Union imploded. Over 80% of Cuba's trade disappeared. So as a result, you see massive shortages. And I spent a lot of time during the early days of the Periodo Especial in Cuba. Cuba continued to receive kids, 25,000 kids, most of whom came with a guardian and received free accommodation, free food, and free medical care on the island. Extraordinary. Medical education, ELAM, the Latin American Medical School, outside Havana. The Naval Academy was closed down to make way for the Latin American Medical School. 29,000 physicians have been trained at ELAM, mostly at no cost to them, precisely to provide physicians for the global south. In Venezuela, 25,000 medical doctors have been trained, formed by Cuban medical professors. Medical schools have been set up in Africa, Latin America, in Asia by the Cubans. So in terms of medical education, no one in the world has done as much as Cuba. There's also Operación Milagro, Operation Miracle, the eye surgery program that's been set up mainly in Latin America and the Caribbean. In 13 Latin American and Caribbean countries, there is now a program of eye surgery. So over 4 million people who could not afford to have cataract surgery or treatment for glaucoma have been treated at no charge to them by the Cubans. Again, an extraordinary example of collaboración on the part of the Cubans. And finally, the Henry Reeve Brigade. Henry Reeve was an American who fought in the First War for Cuban independence. The Henry Reeve Brigade was formed just after the United States under George W. Bush refused to accept Cuban offer of assistance after massive problems in New Orleans. You may remember Hurricane Katrina. George W. Bush refused to even acknowledge the Cuban offer. Shortly afterwards, Cuba sent a massive delegation to Pakistan after an earthquake, and leaving 32 hospitals behind, and also providing medical scholarships for 1,000 Pakistani kids. So in not only in the early years, but ever since the early years, we've seen the continuation of Cuban medical support. Yet so little is known about this. There are so few reports in the mainstream media, and this is tragic because this is the greatest story that's never been told. It is an example that goes, Cuba at the moment has got more medical personnel working than all of the G7 countries combined. Yet very little is known about it. It no longer deserves to be the world's best kept secret. So what I've tried to do briefly is to provide some data on the current situation to explain the very early years, how this was set up. I was very fortunate on several occasions in 1994 and 1996. I actually met with President Castro and talked about this. And it was extraordinary to see what I see as an obsession with public health, an obsession with delivering to the global south, with sharing what Cuba has. And many people have referred to the fact that Cuba does not give its leftovers, it shares what it has. So to conclude with some key themes, first of all, it's important to bear in mind that what we see with Cuba's extraordinary humanitarian contribution with COVID-19, this is not new. Cuba has been doing this since 1960, and it's very important to bear that in mind. As Gail mentioned, over 420,000 Cuban medical personnel have served, mainly in the global south, ever since. COVID-19 is just the latest episode. Any one of the examples that I mentioned, the Henry Reeve Brigade, ELAM, Operación Milagro, the Chernobyl kids, any one of those would be an extraordinary story for any rich, industrialized country in the global north. Any one of those would be truly exceptional. Yet Cuba, a small country, a poor country of 11.2 million, did all of these and has done this for over 60 years. What an example for humanity. It is extraordinary. So when we in the so-called developed world see this, I find it embarrassing to see just how much Cuba has done. I did my PhD thesis on the socio-political thought of José Martí. And everything in Cuba comes back to Martí. Martí had this beautiful phrase, 3 words: patria es humanidad. All of humanity is our homeland. And I think that the Cubans, with their Medical International program, have shown that very, very well. So we need to let people know about this extraordinary contribution, which is widely ignored. It should not be the greatest story never told. And I understand fully why the worldwide campaign for Cuba to receive the Nobel Peace Prize has started. It is timely, it is appropriate, and we have so much to learn, because indeed, patria es humanidad. Thank you.
Thank you, John, so much for your passion and your words. The greatest story to be told, and I think people like yourself and your work and your studies and your writing contribute to that need really to tell the story of Cuban medical internationalism, because it really is quite a miracle, and it is something that, if repeated by countries around the world, imagine how much more we could be doing to help people around the world. You'll be pleased to know that around 200 people have now joined this meeting on Zoom and also on YouTube, people from here, UK, but also from around the world. So if you've joined late, welcome once again to all of you for joining us in this important meeting. Now, many of you I know may be aware that the United States has been running a vicious campaign against Cuban doctors working in other countries, and against its medical brigade program. And last week, on Thursday, in fact, 3 Republican senators introduced a new bill to the Senate in the United States, which aims to punish countries around the world that are working with Cuban medical brigades. And they're basically implying that Cuba is somehow trafficking doctors, and these doctors are working in other countries against their own will. And that's something that we hope we and people like John and Gail and our other speakers are able to counter. But it's nothing like hearing directly from those doctors themselves. So we're just going to see a very short 2-minute film with some of the Cuban doctors speaking about their international work. Hopefully it will go ahead now.
This business of forced labor is the functional equivalent of slavery.
Esclavo yo que recibo de mi país todos mis estudios gratis. Esclavo yo que mi familia recibe mi salario completo estando fuera. Esclavo nosotros, así es la teoría de ellos.
Nosotros lo hacemos voluntariamente. Nadie a mí me obliga a ir a ese país. Cuando otros países del mundo nos tildan como esclavos, pero a nosotros eso no nos importa. Lo de nosotros es contribuir con el mundo, contribuir con la humanidad.
Porque hay otros pueblos que me necesitan. No deben de morir las personas cuando hay profesionales y personas que estamos capacitadas.
Voy porque soy médico. En definitiva, para eso se deben formar los médicos en el mundo, para curar personas. No importa si es en Cuba o en cualquier lado del mundo.
Eso forma parte del genoma humano de los cubanos y simplemente ayudar a que lo necesite. Yo sí no era nada más justo que nosotros pudiéramos ayudar a otros países.
I hope you enjoyed that short film. It's wonderful to see doctors firsthand, and we ourselves had Dr. Virgil Fonseca with us last year in the UK, touring around the country, explaining about the work that he did in a number of those medical missions. But we're just going to do a slight change to the order here because we're very pleased to have with us a speaker, Joaquin, who in fact was a United States doctor, US doctor, who trained at the Latin American Medical School in Havana. So we're just going to hear from Joaquin first of all. Joaquin is, I'm just looking for my notes. Joaquin Morante studied for 6 years at ELAM, the Latin American Medical School. He's now a specialist in general pulmonary medicine and critical care medicine at the Jacobi Public Hospital in New York. And he's joining us in the middle of one of his shifts, which is why we want to slot him in now. You can imagine with New York being one of the epicenters of the pandemic in the United States, it's been very difficult to find time for Joaquin to join us, but he's with us now and we want to hear from him now. We're going to do it in the form of a short interview, so I hope Joaquin is with us, but he's going to give us some examples of what life was like for him training in Cuba, and also some of the lessons that perhaps he learned in Cuba during his training. And I'm sure many of you, as others, Gail and so on have said, Cuba offers free places, free study to generally people from developing countries, but also some communities in the United States to study at the Latin American Medical School completely free of charge, to give access to people who perhaps can't afford to train to be medics in their own countries. And the only commitment they make is to go back to their communities to work with their communities in their country. So hi, Joaquin, I can't see you, but I'm sure you're there somewhere. If you could maybe just introduce yourself, tell us who you are and just a little bit about your role at the moment in your workplace right now.
Sure, it's nice to be with you, Rob, and it's nice to be with everybody else today, this afternoon. My name is Joaquin Morante. I was a ELAM student from 2006 through 2012. I come and hail from New York, from the Bronx. I work currently in the Bronx at Jacobi Medical Center, as you said, Rob. We're part of the public hospital system here in New York City, one of the largest public hospital systems in all of the country, actually. And I have had the privilege of being able to come back to the Bronx and be able to work here with my community and, you know, serve my neighbors and many people around here, thanks to the education that I received at ELAM some years ago. I did my residency and trained here in New York City after graduating from ELAM. I've trained in Brooklyn and Queens and the Bronx. I have served New York and will continue to do so.
Okay, wonderful. So you graduated from the Latin American Medical School in Havana in 2012. Can you tell us a little bit about how you accessed that program, how you got to end up training in Havana, what it was like, and a little bit about your experiences on that program in Havana?
Sure. Well, you know, coming to go to Cuba or to apply to go to the medical school really came out of this fusion or this desire to mesh, public health with actual personal care of people. And so looking at a system and looking at an educational setting that would be able to provide that type of education that would make me a more well-rounded doctor, a more well-rounded citizen, a global citizen, and listening to folks and really being educated on it, it seemed like Cuba was the right place. And so I made this leap of faith to go there, and quickly realized that it was the best place for me in terms of in my training. It gave me all the pieces of medicine that I was looking for. Looking at not only treating people and pathologies, but really looking at trying to improve the wellness and health of a community, and looking at health and looking at medical delivery, not on the individual level, that's definitely part of it, but also on that wider community and even global scale. It goes to everything that I've heard the previous speakers talk about. It's not just taking care of Cuba, it's also taking care of the world. And that is transmitted quite clearly through your time and your education down there on the island.
Okay, wonderful. I mean, I'm assuming yourself and many of the other students at ELAM, one of the main reasons was the cost involved in studying medicine in your own country. So perhaps you could mention a bit about that, but also could you maybe say something about the differences that you found out about learning to become a doctor in Cuba as opposed to studying for a medical position in the United States? What were the key lessons you may have taken away with you? I know you've touched on that, but the key lessons you may have taken away with you from Cuba.
Yeah, sure. Well, as you said, it is a scholarship. It is a full scholarship that is given not only to just North American students, but also students from all of Latin America, Africa, Southeast Asia. It is a scholarship that you're provided with the belief that you're going to go back and do what I'm doing actually, which is go back and work in the community that you come from, or work in an underserved community that really needs more medical professionals. In terms of the differences there, I think that really the important one, I mean, we can talk about, the differences in medicine, and, in the end, medicine is medicine. And there are some things that are stressed there in terms of kind of the basics of medicine, making sure that you have a strong clinical exam and so forth. But I think really the lessons that I learned are the ones that I touched upon earlier. It's that as a physician, it's more than just treating people and pathologies. It is understanding that each person that we treat is part of a larger community, and that their health and their wellness is predicated upon the wellness of the community, as we say, those social determinants of health. And so Cuba, in your training, keeps you from the very beginning on a community level. As you know, its health system is very different than ours. Their primary care setting is usually within the community. People don't go to the doctor goes to the people, which is a fundamental difference in how we provide care here in the United States. Families are identified by risk factors, and that gives them priority. Doctors who see that and who identify those risk factors make sure that they pay extra attention to those families and those family members, so that you can have a more humane approach to medicine, but also to increase the wellness within a community. Here in New York, in the Bronx, we deal with generations of illness, where people have its grandmother, its mom, and then their children, who are all suffering from different chronic conditions. And because we haven't addressed that, it's not just the individual, but it's what those conditions that kind of propagate and perpetuate these illnesses and these diseases that we continue to see within our communities.
Thank you, Joachim. The Cuban model of healthcare, I mean, you've spoken about it, and you mentioned primary care, and anyone who goes to Cuba sees the relationship and the number of doctors and medics as part of the community. What kind of lessons on a very practical level from the Cuban model do you think may help countries like our own in the UK, in the US, in terms of treating, I mean, particularly in this current pandemic? What kind of things may, on a very practical level, have improved the result, could have improved the results in our countries?
Right. I think, you know, we're talking about Cuba has developed I believe, one of the most sophisticated healthcare systems. It's not piecemeal. It doesn't leave it up to, hey, you guys do whatever you want to do on the West and we'll do whatever you want to do on the East. It really does respond to the whole, to the nation. Something that here in the US, obviously we don't have. If you take COVID-19 and the coronavirus as an example, where there has been no real unified response, nor have resources been applied uniformly or actually to communities that most need it. It has been, kind of a sink or swim approach, and we have suffered because of it. New York City alone, we're surpassed almost 25,000 deaths. That is a preposterous number to have. So, for the lessons are, number one, you have to be proactive. You cannot be reactive if you're talking about wellness and health. We seem to not have learned that lesson, and the Cubans are a shining example of how it does not take much. It doesn't take a rich country, actually, to be proactive. What it takes is will, and what it takes is values. Values that put people above, the economics of it. I think that if you were to ask me now in the post-COVID world, where you see that most starkly, it's right now, where we have not been proactive. We have not looked at being preventative, and we have not gotten in front of what we saw was a looming threat.
Thank you, Joachim. I know that you are in the middle of working, and I know it's a very, very busy time for you in New York. I don't want to take up any more of your time. I mean, if you wanted to say anything else, do so. But I'd just like to thank you very, very much for spending some time with us to share your experiences. I know many of us will have been to ELAM. I have myself. And you see the students at ELAM, and it's in Havana, it's in Cuba, and it's wonderful. But to see the results of ELAM and to see yourself as a fully trained and rounded doctor working so tirelessly for your community is a real testament to you as an individual, but also to Cuba as well. So thank you so much, Joachim, for your time. Thank you so much for joining us. Thank you.
Well, thank you for your support. Thank you very much.
Thank you.
Okay.
And of course, we thank all medics around the world at this time. Of course, we all have. But thank you. It's great to hear from Joachim, someone who's learnt in Cuba how on his training. Okay, our next speaker we're going to move on is somebody I've known for a long time, Gail Walker. The daughter of Lucius Walker, but who is now also the executive director of the Interreligious Foundation for Community Organization, IFCO, as we know it in the United States. And Gail has continued the work coordinating the annual blockade-busting Pastors for Peace caravans each year, which send vital aid over to Cuba and show a better way of engaging with the island. But they're also involved in facilitating scholarships and medical placements for US students to study at ELAM, like Joachim. And Gail is going to talk a bit about her work, and particularly about that work and the history and the legacy of exchanges and the scholarship program to ELAM. So we're very pleased you're here, Gail, and over to you now.
Very good. Thank you, Rob. It's been wonderful to hear from the various speakers that have come before. It's difficult in a situation like this what to pick and choose to share. Speakers have spoken so eloquently about the history of Cuba's medical internationalism. But it's really important, I think, for this kind of informational program to be shared. And so I want to thank you, Rob, and thank the Cuba Solidarity Campaign for organizing this opportunity. As I said, the previous speakers, I think they all spoke really quite eloquently about the history of Cuba's medical internationalism. For years, Cuba has exported health and medical personnel across the globe whenever there was need. Gail spoke about Chile and John about the Ukraine, but from Africa to Asia to Central America, South America, the Caribbean, Cuba has always been there, and despite its limited resources, has continued to export doctors to various places in the world wherever the need has arisen. But I think it's important to talk, and I'll talk a little bit more about ELAM. I'm wonderful that we had the opportunity to hear from Joaquin Morante, who's a ELAM grad, who's currently on the front lines doing just what he was trained to do at ELAM. And we're pleased that he not only has been able to take advantage of that opportunity, but is also continuing to work with IFCO's Medical Advisory Committee as we continue to really encourage young people who are interested in becoming physicians, can't afford to pay the outrageous cost to study medicine in the United States, and have a real commitment to community medicine. And that's really what ELAM is all about. So IFCO, amongst the various other things that we've been able to do, continuing the blockade busting caravans that you referred to, Rob, but we've also been really pleased to be the sole entity in the US to help recruit and not recruit, because that's a general useful thing that we encourage everyone in the US to help us to do, but to at least recommend candidates for our friends in Cuba to accept to the scholarship program. But I just wanted to take a step back and just reiterate something that John spoke about. It's really this conversion, the vision of the late President Fidel Castro to really take a step further than just providing doctors, not just, I don't mean to diminish it, but providing doctors in various parts of the world. But I like to think of it as taking a look at following the adage, if you give a person to fish, they eat for a day, but if you teach them to fish, they eat for a lifetime. And that's really, in my mind, what ELAM was about. That vision that Fidel had resulted in the conversion of a huge naval barracks into an internationally renowned medical training facility where young people from across the globe could study medicine, most of them free of charge, to allow the countries where these students came from to have culturally competent doctors to care for its own citizens. And that obsession that John referred to, I think is really, that Fidel had, was very evident and so incredibly needed across the globe, excuse me. And despite, it never gets old to talk about the fact that, Cuba's doing this and offering this opportunity to include young people from the United States, to train doctors that come from the United States in Cuba, despite the US government's longstanding punitive blockade. And it came about, this project, this offer, as the result, it came about during a Congressional Black Caucus delegation that was organized by my father, you mentioned, Lucius Walker, IFCO, in May of 2000. This offer to provide scholarships was made by Fidel during a meeting between some members of the caucus and him. And it was specifically a congressman from Mississippi, the Mississippi Delta area, Benny Thompson, who spoke about the incredible health disparities in the Mississippi Delta area. And Fidel, being the very learned, educated, bright, shining light that he was, indicated that he was aware of those living conditions and the lack of healthcare services in Mississippi, and extended an invitation initially for young people from Mississippi to study at ELAM, Latin American School of Medicine. And soon after, that invitation was extended to the entire country of the United States to join the various other countries that were sending its young people there to study. The scholarships to study, as it was mentioned, were really awarded with the understanding that recipients would do as Joaquin is doing, practice in communities where the need is greatest. And for the past 2 decades, thanks to this generous offer of Cuba, tens of thousands of young people from more than 125 countries have received training as physicians in Cuba, under full scholarship, including from the US. And again, it's incredibly powerful for those of us particularly living in the United States, and I think for those outside the US, to witness that this offer has been made to include young people from the US, despite this brutal policy, this brutal blockade policy that's been in place for more than 6 decades. To date, Cuba has trained 185 US doctors to practice medicine in underserved communities across the United States. And due to the long-standing history that IFCO has had of working for justice in general on a variety of different fronts, and standing in solidarity with Cuba, not just with caravans, but with delegations, and providing informational exchanges whenever possible. It's been our distinct honor to assist in identifying young candidates from the United States for the scholarship program. And there are currently 70 young people from the US that are studying in Cuba now. And we're still in the process of receiving applications from potential scholarship recipients for the next class. The timeline has kind of been stretched out somewhat because of COVID, but we're busy working, members of the Medical Advisory Committee, reviewing applications and looking at the next cohort to take advantage of this great opportunity. But IFCO saw the immense value of Cuban-trained doctors practicing in US communities, understanding that there are a number of ways in which Cuba's approach to health would greatly benefit those living in the United States. I think it was Gail Reed who laid out the differences between the healthcare system in the US and Cuba very well. In addition, I'd only add that while Cuba's GDP is about 1/10 of the US, and while it lacks access to many drugs and medical equipment thanks to the US government's policies, life expectancy is greater in Cuba than it is in many parts of the United States. And that's definitely worth always noting. Cuba's focus on preventative care under a national healthcare system is critical, is key. As was said before, that's a stark difference from the way that medicine is practiced here in the United States. Another critical difference between the US and Cuba is the doctor-patient relationship. As I think it was Joaquin who said, in Cuba, the primary care physician, lives they live where they work. They live in the community. Often their home is typically above the clinic that they operate. And finally, it's important to note that thanks to Cuba's offer to train doctors that are now practicing in various parts of the US, the broader US population is benefiting from Cuba's approach to healthcare, which places an emphasis on community medicine. And that's why I really feel, and those of us at IFCO, and I think those who support this project, feel that this is why Cuba's gift through the ELAM scholarship program benefits more than the individual students who receive the scholarships or their families. Ultimately, Cuba's gift is having an impact in the various communities where these doctors are practicing or will practice. The hospital that Joaquin is working at is receiving patients who are benefiting directly from Cuba's approach to medicine. And that's part of why it feels very important to mention that this Cuba medical internationalism is having an impact here in the United States too, despite the fact that the US government is you know, blocking doctors from coming, is you know, hypocritically referring to Cuban doctors that are selflessly, generously giving their time and their talents as slaves. Despite that, Cuba's approach is having an impact through these ELAM physicians. Indeed, the seeds that Cuba has planted are bearing fruit, and that commitment on the part of the graduates is being put to the test at a time when we need it most, and that's during this coronavirus pandemic. So I'll just end by just stating affirmatively that as we work, we in the United States, activists, the progressive community, physicians, as we work to revolutionize healthcare in the US, it's indeed a blessing to have Cuban trained doctors working in some of the most underserved communities across this country. And we thank Fidel Castro for his vision and revolutionary Cuba, both the government and its people, for their incredible generosity. So thank you again for having me, and thank you for allowing me to share.
Brilliant. Thank you, Gail, for your lovely contribution. It's wonderful to hear from you, and the work you do is incredible, not just in the US, but around the world. I've seen you at a number of meetings here, there, and everywhere. So it's lovely to be have you here on one of our platforms, and I hope we'll see more of you. Perhaps in the UK one day would be wonderful. So that would be great. Thank you so much. Listening to your words and Joachim, I was pitching the Cuban ambassador, who may be inundated with requests to go on scholarships to Cuba. So it may be something the Cubans may have to think about. I don't think the program runs in the UK right now, so I'm not sure that's something we'd be pushing for, but I'm sure we have requests for people who want to go over to Cuba to do the training. But thank you once again, Gail. We're very pleased to welcome our next speaker, Lara McNeil. Lara has just graduated, qualified as a junior doctor, and is now working over here in the UK. And she did her final medical elective in Cuba very recently, just at the outbreak of the pandemic. So I'm very pleased that we can hear from Lara. Lara is also a member of the Labour Party National Executive as the youth officer on that body. So we're very, very pleased to hear from Lara McNeil.
Hello, thank you so much, Rob, and everyone who's joined the call today. It's a privilege to be asked to speak, and to thank you so much to the speakers who've spoken so far. I've been typing out notes. It's just really interesting to hear the different perspectives on this. As Rob said, I'm on the Labour NEC, so I represent young members in the Labour Party in the UK, and I've just graduated as a doctor. I did my elective when I was a final year medical student, which was from January to March this year. I had to come home 3 days early for because of the COVID flights, flights shutting down and things. But yeah, it was an amazing experience. And I just wanted to talk a little bit about my experience in Cuba, the influence it's had on me as a doctor in the UK, and how it compares to the UK system. You know, we've heard very eloquently how it compares to the US system, which is extremely depressing. But the UK is a different system. So it's I'm just going to speak a little bit about that. I think on the US thing to start with, I think the big kind of elephant in the room is just how much it costs to be a doctor. In the US, it's crazy amounts. In the UK, I've got about £80,000 worth of debt, which is obviously completely different student debt to the US, where I know it kind of functions like similar to a normal loan. And obviously you've got the benefits in this country, but obviously in comparison, it's completely free to study in Cuba, which meant the diversity of medical students in terms of, their class background, where they came from, their race was so diverse compared to medical students in the UK. And I'm sure it's often worse in the US. And in the UK, I think it still is hard to get into medicine if your parents didn't go to university. The thought of debt is a big barrier to most people. And certainly I didn't feel like I was represented in what other medical students look like. And I think that does affect how you are as doctors, the kind of people going into it. I think in in frank terms, I would not be a doctor if I lived in the US. And that just shows that the kind of system that the UK is trying to go towards. And it's extremely worrying. And I just send my complete solidarity to those in the US who are campaigning for Medicare for all and you know, a proper public health system which trains doctors from all walks of life. I think my main kind of other things that stood out for me on my elective were staffing levels, just the amount of doctors. And I know everyone says this, but it's really such a big issue in the UK. The amount of people studying to be doctors and nurses is a struggle. With the nursing bursary being cut in this country, for example, we've seen nursing applications go down year and year in universities. We're seeing increased roles of things called physician associates and other things which are, you know, they're fantastic roles, but ultimately it's a quicker way of filling the gaps that we have in terms of people going to university and studying to be doctors. And I'll come on to how that's been a big issue in the COVID crisis in a second. I think as well, obviously, preventative medicine, we talk a lot about Cuba being great on this, and I think some people kind of misunderstand what that means. That doesn't mean that Cuba is removing risk factors from their population, but it does mean they're intervening early and doctors are really present in the community, as other speakers have already said in better words than me. But that is such a big issue in the UK. I think, for one, the healthcare system is so fragmented and privatized that you go to your GP and then you might be waiting months and months for a specialist appointment. And then this doesn't really communicate back well to your GP. Whereas in Cuba, the focus on primary healthcare and bringing tertiary and secondary doctors into primary healthcare just means that patient care is a lot more patient focused, it's less fragmented, and it delivers better outcomes. I think it's one of the key frustrations of patients in the UK, and unfortunately does lead patients to kind of resent the NHS in a lot of ways, which I think is a deliberate tactic by the Tories to try and make them think that the public healthcare system doesn't work, but actually it's the way they have fragmented it in such a way and not focus on preventive healthcare. I think it's one of the things I'd like Labour to focus more on in this country is calling the Tories to focus on preventive healthcare, because it saves money and it delivers better patient outcomes. So yeah, I think the time to see specialists is a lot less in Cuba, and I think that is the, you know, if people have a specialist medical issue, it's the best thing for patients is to see someone who knows about that. And as well, I think someone mentioned it earlier, the gender breakdown of doctors as well. Like in this country, you know, if you're an orthopedic surgeon, you're most likely to be male, and it puts a lot of women going off into those things. And I think in specialties, we definitely saw a more equal distribution of senior doctors being women, which was just great. And it shows that when you reach out in terms of diversity with free education, the kind of products that you get in the end and the influence that has on the wider healthcare system. I think the way it has influenced me as a doctor in the UK, I think you can feel quite helpless as a doctor in the UK sometimes. You feel like you're treating a patient, but ultimately the reason why they might have come into hospital will be social reasons. It will be because of their job, their financial insecurity, their mental health issues, their substance abuse, things like this we see on a daily basis, and you feel very helpless. And I think you have to be political as a doctor. That's the one thing that Cuba and just being involved with politics has taught me. I don't think it's enough just to be a doctor. I think if you want to be a doctor providing good care to your patients, it's your duty to campaign for a public healthcare system, free at the point of use, and against the kind of people and politicians who want to fragment that. And we know that Cuba is a healthcare system which is an example to all other countries in the world, as the UN has said, and people have mentioned life expectancy. It's basically the same as the UK, which is amazing. And Cuba spends less per capita on healthcare in general than we do in the UK. Less per capita, but they dedicate more of their GDP. So they dedicate about 11% of their GDP compared to the UK's 9%. And it just shows that efficacy is such a key question when you have got a country like Cuba, who is economically isolated in many ways and has problems with resources. They have to focus on efficiency. And ultimately, with the privatization and fragmentation of the healthcare service in this country, it is not efficient at all. And there is money pouring out left, right, and centre, which has been accumulated in profits for the richest and is not going towards patient care. All the while, the Tories are saying, oh, this is why public healthcare is not working. So it's a key political question. I think Cuba has placed a big focus on social care, population aging, because they've had to face this because their healthcare system is so good compared to others in the region. They've actually had to face things like a more developed, I know it's not the best word, countries have facing with aging populations. And, you know, we're dealing with it so poorly in this country. I know someone mentioned about them going out to social like care homes and making sure people hadn't got symptoms of COVID-19. Compare that to this country where we completely ignored care homes, and deaths in care homes were one of the biggest scandals of the COVID-19 crisis in the UK. And it just shows that, you know, because our social care system is not nationalized, how awful that is. And it's just being ignored by politicians. And it you know, it's been promised again and again to be addressed. And I think it's one of the biggest issues of the day. And we've seen how all these things that I've mentioned have related to the COVID crisis more acutely. Staffing, I think, was such a key issue in the UK. Almost a third of the workforce was off sick at one time, and they had to be because, you know, they were spreading a virus. They had to go off sick, and it just suddenly showed the amount of, you know, how close we were, our staffing levels were to the line of what it was. We had no slack, we had no excess doctors to come in during this time of crisis. And Cuba really shows how that can be done differently. And I think in times of, you know, where capitalist countries want to get that, you know, maximum efficiency, not hiring any more than we need, it's in a time like COVID, it just shows that that does not work. I think in the lack of testing as well, again, we see a difference between the UK and Cuba, you know, and essentially other capitalist countries where just testing was not done, blanket testing. People without symptoms were not tested. People weren't seen until they had symptoms. You know, in the hospital that I work at in this country, and I work with COVID patients, we were up till recently not tested until we had symptoms. This makes no sense to anyone. You don't have to be a doctor to see that. You need to be testing asymptomatic people. And just those questions about profit and availability, you know, became more of an issue than actually the lack of testing and that effect on public health. So also we see a difference in the quarantine, how Cuba quarantined a lot earlier than the UK with lower cases. I mean, that is just a disaster. We obviously, I'm sure everyone really knows how bad the UK is doing in terms of deaths. And I think these key differences show that the UK has one of the lowest productivities percentages in Europe, and that's shown with the lack of PPE and the lack of testing. We just weren't able to get these out to our population fast enough, and a combination of all these reasons is why we have done so badly. So I know I've been babbling on for ages, so I just want to sort of finish with, I know people have mentioned the solidarity that Cuba has shown, which has been absolutely inspirational, as they always have. We saw that with the cruise ship, which was you know, allowed British citizens to safety in Cuba. You know, it forced the Tories to congratulate Cuba in Parliament, which was quite funny and ironic. But it just shows that Cuba knows what solidarity is in actions, not words. The British government and too often the Labour Party has offered solidarity in words and not actions. And that is a lesson that we can learn. Look at the doctors they are sending to countries all over the world, not because they want anything in return, but because they care about not just the health of those in their country, but wider. And it shows why our solidarity for Cuba is so important at this time. You know, the pandemic has exacerbated the shortages of goods they have. And, you know, we know this is caused by US sanctions mainly. So it's so important that we send that solidarity back to Cuba. The failure of capitalist countries to approach COVID shows the complete baselessness of our perceived superiority in the world that our leaders like to perpetuate. It shows the inherent failings of this system that puts profit before people. And we know that solidarity and collective actions are needed more than ever. And Cuba is a perfect example of that. Thank you so much.
Brilliant. Thank you, Lara. Thank you so much again for taking the time to join us and for your work, obviously, in the NHS and alongside all your fellow workers. Thank you so much for your time and your solidarity. And, of course, your work within the Labour Party to drive forward a continued position of engagement and positive engagement with Cuba. Thank you so much. Time is short, but before we move on to a few of the questions, we'll only have time for a few of them if we're going to finish about 8. I just want to ask very briefly to invite Her Excellency Barbara Montalvo, the Cuban ambassador, just to say a few words. I know she wants to. So Ambassador, over to you.
Very quickly. Well, an affectionate greeting to everyone. It's really impossible to don't express immense and profound gratitude for the initiative like this. Those of today was very, very valued testimonies and very, very moving too, especially for us, for Cuban people, and of course for me. And today I'm here to join all of you. This is not a moment to say nothing, because this is a moment to join all of you and above all to listen to. It's very grateful and very emotional this moment, and thank you very much. Rob is a great friend of Cuba here in UK with many other people, and I'm very ¿cómo decir? I'm very grateful because I know very many people around the world are listening to testimonies very valued to express this afternoon. So congratulations and thank you on behalf of the Cuban people. Thank you very much from the bottom of my heart, really.
Thank you, Ambassador. It's lovely to see you here. And on behalf of everyone, I'm sure here, but across certainly the Cuba Solidarity Campaign, we'd like to pass on our thanks to you, your staff, but also to the people of Cuba for the example that you show, particularly at these times of international crisis as we're suffering now. So thank you once again for your solidarity and your support. So we only have about 10 minutes, so we don't have time to take all the questions. We had quite a lot of questions sent in beforehand, but I've picked out, or we've picked out a few of them. And what I'm going to do is just go through the 3 questions that I've chosen, and then if all of our speakers, if they want to come back in and say anything either about the 3 questions, or if they want to just say something very briefly in summing up, maybe I'll try and point people to them. But the questions that we have, the first one was about measures taken by Cuba to reduce transmission rates, and how has the Cuban government been communicating with the Cuban population about what needs to be done? And maybe Gail Reid could say a bit more about that. I know she mentioned Dr. Duran and the daily briefings, but how does that disseminate the information? So maybe Gail could mention that in her summing up. There's another one here about health workers in Cuba and whether any have died from contracting coronavirus in Cuba, but also abroad perhaps, and how that compares with the United States, for example, or indeed the UK. Again, maybe Gail or Lara might want to say bits about that. And then finally, something perhaps John or Gail Walker might want to focus on. There were Cuban doctors in countries such as Brazil and Bolivia and Ecuador, and that cooperation program was ended by those countries in effect after pressure from the United States. And do you think that this latest attempt by those Republican senators will be successful? And if so, or if other measures in the US are moved forward, will they be having a big effect on international cooperation agreements and cooperation from Cuba to other countries? In what way will the US be able or be successful in trying to stop Cuba's international solidarity? So they're the kind of 3 areas. So I don't know, perhaps if Gail Reid wants to come back and maybe if she wants to say anything briefly in summing up at the same time, that'd be great.
Sure. In terms of communicating with the public, Cuba has gone all out. It's not only the daily press briefing and the newspapers and television and this expanded use of the primary care doctors and nurses. They even have cartoons for the kids. I mean, it is huge. It's also many more people in Cuba are now on social media and the internet. So there are now statistics on a daily basis available, health messaging, You name it, they've done it in terms of the communications. I think I reviewed some of the measures that have been the most important. Probably the most important thing of all is that the Cuban public has faith in their health system. And so they follow the measures, which doesn't mean that there aren't undisciplined people who are, who create problems, but it does mean that the vast majority of people are listening to the science. They're listening to why. These are highly educated people in Cuba, and they know what they're doing, and not just the people who've devised the strategies, but the people on the block. There have been no Cuban health workers at all who have died from COVID. I cannot compare that to other places. Maybe other people have the figures, but I think that one thing is pretty impressive. The only thing I would like to say before Gail and John speak about the US and its pressures is, I have to say, I have read the UN definition of genocide, and I believe that the United States government is committing genocide against the people of Cuba, against 11.3 million people, by trying to stop oil shipments, by trying to stop supplies of vital medicines and PPE gear for its health workers. Every single thing this Trump administration has done against Cuba, and now there are more than 90 measures, is to keep money from going into this health system, to keep food out of the mouths of the Cuban people, and that constitutes a genocidal policy. And I have to speak out against that, and I think any person of goodwill has got to take this on, because in the United States, it's very easy to become insulated in the problems because they are great. But what the United States is doing to Cuba has no moral or ethical justification.
Thank you, Gail. Gail Walker, did you want to come in on perhaps the international pressures on Cuba?
Sure. Yeah, I mean, I agree with what Gail Reed had to say strongly, that this is the despicable behavior on the part of the U.S. government, and it's been, a long-standing policy. I think the whole idea of, just sort of throwing the, the Trump administration sort of throwing the kitchen sink at this. I mean, they've done everything that they can think of to try to undermine Cuba. I think some of this dates back to the successful press, if you would, that Cuba was getting internationally. When you go back to what was happening in the fight against Ebola, there was nobody that was out there that was literally running toward the fight, prepared. Not to say that there weren't fears, but people were, these Cuban medics were prepared to go and provide service that so many others were not doing. And I think that my sense is that a lot of the current administration's, a constant, barrage and attack is to try to counter that kind of positivity. But there are a lot of people, and we hear this constantly, who know about Cuba's medical internationalism. I mean, they're fully aware of that and supportive of it. So I want to believe that those representatives will not have any success with their campaign. And I think that part of the work that we need to do, we all in the U.S. need to continue to do, is to counter the lies and the misinformation that has been put out. That's, and to hold similar kinds of initiatives like this, and to encourage more people to think about becoming Cuban trained doctors and getting back to the U.S. and showing, illustrating just what it is that Cuba has to offer. So that's my 2 cents. The last thing I wanted to just add to what Gail had said is that also in the daily news, there's, every single, the print press, the radio, I mean, there's constant COVID reporting. It's really been quite amazing at how well Cuba has been able to disseminate information, in addition to, of course, those wonderful briefings. But thank you.
Thank you, Gail. John, did you want to say something about the pressures against national brigades?
Yes, please. Ebola that Gail just mentioned, the UN appealed, the WHO appealed for people to come and help. The very first country to come was Cuba. 254 medical personnel went, extraordinary. In regards to the impact on 3 countries where Cuban doctors were basically told to pack their bags and leave. Ecuador, Guayaquil, where there was a large contingent of Cuban doctors, has got an incredibly bad record of COVID deaths. Bolivia, with its coup, its political military coup, likewise has seen a massive spike in deaths. And of course, the Trump of the tropics, Bolsonaro in Brazil, it pains me to think about the number, the 50,000 people have died in Brazil. How many of those lives could have been saved if the Cuban doctors had been there? Extraordinary selfishness on the part of the US government to pressure these countries to get the Cuban doctors out. In terms of what impact will it have, I think the foreign minister of Andorra put it very well when the US tried to put pressure upon her, and she said basically, we have an independent foreign policy. You might not understand that, Mr. Trump, but we will decide what we want to do. And I think that in the end, it will not have as much impact as Trump would like. Maybe some impact, but I think the fact that the Cubans are now in Italy very successfully, one contingent has left, but the other brigade is still there. This has shown the way. This has given instant credibility. In Qatar, the Cubans already had a hospital with 400 medical personnel. Another 200 have gone to help. Despite what Trump wants to do, the world is waking up. And the Nobel Prize nomination, so thoroughly deserved, I think will continue to do that. And hopefully Mr. Trump will be a sad memory as of November, and the world can move on.
Let's John, for sure. Lara, did you want to say anything just briefly in summing up at all? Any messages?
Yeah, I think obviously the answer to the question is this is why solidarity is so important. It shows why the working class movements in the US for Medicare for all and for replacing Trump are so important, because it impacts on Cuba and the world more widely. And it shows why it's amazing that we're having these discussions, not just in the UK, but across borders, and why we need to learn from each other about how to go forward. And yeah, on the communication question, that it sounds like Cuba has done a very good job, and in comparison the UK has done a horrible job. I think they've been scaremongering, it's been bad communication, it's been not based on science, it's been very confusing. I mean, I still find it confusing having to explain how many days post-exposure and all that. Like I still don't understand it. There's a lot of lack of trust in the government, and it means that people just don't follow the guidelines. And, you know, beyond that, working class people continued to go to work in the beginning bit of the crisis because they, you know, had to feed their families and there wasn't provisions for them. So I think it just shows, you know, how communication and a strategy was put in place a lot earlier in Cuba. So, yeah, I think we have to continue to show solidarity to them.
Thank you, Lara. Well, on those great words about solidarity. I mean, we are here, the Cuba Solidarity Campaign. So I'd like to thank all of our speakers, John Burke, Gail Reed, Gail Walker, Dr. Joachim Marante and Lara McNeil, and also the Cuban ambassador for joining with us. I think it's been a fabulous, really fabulous meeting to hear from people from around the world about the current situation and looking at Cuba's magnificent response to the crisis. This meeting has been recorded. It will be available to watch and share on YouTube through the Cuba Solidarity Campaign website shortly. We are going to have more of these types of meetings. We have one on education in the current situation in July. So make sure you're signed up with Cuba Update and follow Cuba Solidarity on our social media sites, Facebook and Twitter, and then you will receive a notification of the events. So of course, if you're not already a member of Cuba Solidarity Campaign, then please do join the campaign. It is the best way in this country of helping solidarity with Cuba, helping the people of Cuba. There's also the online petition that we run calling on the British government to press the United States government to temporarily lift the blockade at this time of international crisis. And that has been signed by nearly 17,000 people, so you can still sign that. And we've raised nearly £30,000 now in our fundraising appeal for the Cuban medical response. And you can still give to that appeal through the Cuba Solidarity CAN website. And all those websites and the links and so on will appear hopefully at the end of this meeting on this this site, so you can find them there, but just obviously get in touch with Cuba Solidarity at any time. Thank you all once again. If you have any comments about the meeting or suggestions for future ones, then please do get in touch. But thank you all once again for being with us this evening. Thank you all.
Bye, everybody.
Bye-bye.
Bye.